Patient-reported outcome measures have become popular over the last few months. It's something that we've been looking at for about the last 2.5 years or so. We have a pathway project whereby we've been mapping the processes of care right through the patient's journey, so thinking about what happens right from the first letter or the first interaction through to outpatients and then through to the operation. And most people would look at that as a manufacturing process. Now, everybody that understands how to build things know that when you build things, sometimes differences arise. So we've started to look at how we measure variations along that, and we can look at clinical variations when things don't go quite so right, or when patients complain, or when complications arise. But I think a new advent along that journey is to measure what the patient thinks about their health before we start treating them, and measure what the patient thinks about their health 6 months after they start treating them. So we've been embedding this into our e-care pathway project so that we can really start to measure the difference that care makes. So it's not just a gimmick, it's not just an add-on, it's something that we can really challenge ourselves against for our pathways. We've looked at this long and hard, and it hasn't just been a question of benchmarking the outcome measures. It's been a case of taking the whole pathway. So we hope to have embedded all our pathways in some key areas across all 30 of our hospitals during the first quarter of 2009. So it's going to be in the key areas that is being measured in line with the NHS and other insurers, namely hip replacements and knee replacements, varicose veins and hernias. But it's something that started a lot sooner and goes a lot further, because we've built the framework, if you like, to add many other pathways of care and many other measures. Well, we know that the most important thing at the start of any project is to engage locally with our staff, with our consultants and with patients, to find out what they need, what they think, and then to listen to what our ideas might be, and then we can work out which ones are going to work and which ones quite simply aren't going to work. Trying to map that process and standardise it so that we get the real benefits from any change programme are perhaps the next most important thing. And then having a rollout programme that everybody can see is transparent and can believe in, to make sure that we get it in and achieve it well the first time. And I think those three factors have been key for this, as they have been in other projects. Well, I always look for win-wins. I think the real critical step in this has been the pre-assessment. Once a patient has seen a consultant and once the decision has been made to recommend a surgical treatment, getting the patient to see a pre-assessment nurse so that we can plan that admission of care. That's something that the consultants support, it's something that the nurses support. It reduces problems when patients are admitted, it reduces missing bits of information, missing medications, reduces or even prevents delays. And I think if you've got a good idea and people can really see that it brings benefits for what they do, then embedding it is much simpler. And really what we've done is attach the outcome measures to that pre-admission benchmark, and then again at the end of the pathway once the patient has been discharged from consultant care. So we've had a lot of support. Well, it's always important to engage patients, and we do have patient representatives on some of our advisory committees in hospitals, and trying to make sure that we maintain the science behind the questionnaires, but at the ease of the forms being filled in by patients has been key. I think the important thing for patients is to understand why it's important and how it interacts with their journey through our care. So we've tried to explain that in the documents so that we haven't had duplication of form filling, so that patients can understand that it's all about maintaining the quality and improving the quality of their care. We've run 3 very successful pilot programs at the end of last year, and we've had very high uptake rates. And the science behind this is that you need uptake rates in the pretty much close to 90%. And what we've managed to do, partly because we haven't just mailed people a questionnaire, we've had a nurse interact and explain. That's meant that we've had really good uptake rates from our patients who understand why this is important and why we're doing it. So in that sense, the pilots met their objectives and were successful.